Good morning, everyone. On behalf of Third International Ayush Conference 2026, I warmly welcome you all to Plenary 4 Ayurveda. I'm Dr. Hridaya T. Chandran. I'm a clinician practicing in the UAE for past 11 years with a specialization in Prasudi Tantra and Sriroga. It's my privilege to moderate this session today. This plenary brings us to an important and timely theme, reimagining cancer care through Ayurveda, nanomedicine, systems biology, and supportive oncology. Today's discussion topic itself reflects a significant shift in perspectives because we are not merely revisiting the classical principles, but examining how Ayurveda can meaningfully engage with contemporary scientific models, systems biology, translational research, and integrative oncology frameworks. It's my privilege to introduce our session chair, Vaidya Professor Mita Kotecha. She is a former professor and head of the Department of Dravyaguna at the National Institute of Ayurveda, Jaipur. She has also served as a former Pro Vice Chancellor and Dean of Undergraduate Studies at the same institution. She holds BAMS, MD, and PhD degrees in Ayurveda and has made significant contributions to Ayurvedic education and research. She has guided 41 MD theses and 9 PhD scholars who have been awarded their degrees. She has authored 3 books, published more than 100 research papers in peer-reviewed journals, and delivered over 110 expert lectures at seminars, conferences, and symposiums. We are truly honored to have such an accomplished academician and leader chairing this session today. Ma'am, we warmly welcome you. I invite Dr. Anjana to escort Dr. Mita Kotecha to the dais. Now, it's my privilege to introduce the co-chair of the session, Dr. Shrikant Babu Perugu. He currently serves as Director, Department of Ayush, Government of Telangana, and is a PG professor and head of Kaya Chikalsa. He is also the former principal of Dr. BRKR Government Ayurveda College, Hyderabad. A seasoned clinician, researcher, and academician, Dr. Shrikant Babu has treated over 3.5 lakh patients in 3 decades of clinical practice. He has authored books, published numerous research papers in peer-reviewed journals, and headed Telangana's first fully funded integrated research project on mucormycosis. He has trained hundreds of doctors, guided postgraduate scholars, served on various academic boards, and delivered invited lectures across India and internationally. He is the recipient of several prestigious awards, including Ayurveda Icon and Outstanding Doctorate recognitions. We are honored to have such an accomplished leader as a co-chair of this session. Sir, we warmly welcome you. Now, I'm moving to speakers. It's my honor to introduce our distinguished presenter, Professor Katesh V. Katti, globally recognized as a father of green nanotechnology. Professor Katti is a distinguished professor at the University of Missouri and a pioneer in the fields of green nanotechnology, nanomedicine, and nano-Ayurvedic medicine. His groundbreaking work has led to major scientific innovations, including patented nano-Ayurvedic medicine and radioactive gold nanoparticles for cancer therapy. His contributions have been recognized internationally, including acknowledgement by the Prime Minister of India in 2025 and representation of the United States at the United Nations IAEA. He is a recipient of the prestigious International Have Medal for Excellence in Nuclear Medicine and has authored over 300 publications with more than 150 inventions and 50 patents. We are truly privileged to have Professor Katti with us today. We warmly welcome you, sir. Please come to the dais, sir. Now it's my privilege to introduce our speaker, Dr. Jannatul Firdaus Changamballi, Chairperson and Chief Physician at Changamballi Remedium, an integrated hospital dedicated to cancer and complex disorders. With over 30 years of clinical experience, Dr. Changamballi has worked extensively in integrative oncology, serving for 12 years as HOD and oncology consultant in Ayurveda at NIM Super Speciality Hospital and contributing to critical cancer care at the Regional Cancer Center. She has formulated more than 50 Ayurvedic medicines and is an active member of the OSDD Women Scientists Forum. A descendant of the renowned Changamballi lineage of traditional physicians and Marma experts, she brings together ancestral wisdom and modern scientific collaboration. Today, she will be presenting a clinical perspective on the integrated approach to cancer treatment at all stages. We are honored to have her with us. Now, it's my privilege to introduce our last presenter, Dr. Pratibha Shah, BAMS, MD, MPH, an internationally renowned Ayurveda expert with extensive training in traditional health science and public health. Dr. Shah has been recognized for her pioneering contributions to Ayurveda at distinguished platforms including the White House, the Department of Health and Human Services, and the Consulate General of India in New York. She was nominated among the top 20 women of the year in 2014 and previously served as Chief Medical Officer in the Ministry of Ayush. She is a founder and president of the Holistic Health Alliance and the Global Council for Ayurveda Research, CEO of My Ayurveda LLC, and a senior faculty member at leading institutes. She is currently practicing in the Greater Boston area with a global clientele. We are honored to have Dr. Pratibha Shah with us today. Now we can move to the session. Now I invite our chair, Dr. Mita Kotecha, to start the session.
Thank you, Hridaya. Good morning to everybody, distinguished guests, respected colleagues, researcher, clinician, policy makers, speakers, and scholars. It is both an honor and responsibility to open this important session on reimagining cancer care through Ayurveda, nanomedicine, systemic biology, and holistic supportive oncology. We gather today at a critical moment in global health when cancer continues to challenge not only our scientific capacity but also our collective wisdom also. This session provides an opportunity to reflect, deliberate, and re-envision how to approach cancer care in a more comprehensive and patient-centered manner. Friends, cancer today represents one of the greatest public health challenge globally. Nearly 20 million new cases were estimated worldwide in 2022, and in India alone, incidence cases are projected to be around 1.5 to 1.5 million annually. Beyond mortality statistics, what concerns us deeply are the unmet needs of patients: fatigue, anxiety, pain, treatment toxicities, fear of recurrence, and diminished quality of life. Studies show that more than 90% of advanced cancer patients experience at least one significant unmet need despite receiving optimum conventional care. In recent time, we have made remarkable advances, precision diagnostic, immunotherapy, molecular targeting, AI-assisted imaging, and breakthroughs in genomic medicine resulting in improved survival rate, but on the other hand, cancer remaining one of humanity's most complex biological and existential challenges. Despite technology progress, many patients still ask simple question: is there a way to treat me, not just my tumor? This reality calls for the shift towards a more comprehensive patient-centered framework. This is precisely why today's theme is so relevant. While the session emphasizes holistic supportive oncology, it also invites us to adopt broader perspective on integrative oncology, incorporating the most effective approaches from any medical science to optimize patient care. Interestingly, this is a system perspective is not new. Ayurveda, one of the world's oldest living medical tradition, has long described disease as a deputation of systemic balance on Agni, Ojas, those dynamics, Dhatu, that is tissue integrity, and mind-body harmony, and treatment or re-establishing a healthy state is re-established a complete balance of all body components. Acharya Shushrut defined health as samadosha sama agni sama dhatu malakriyah prasanna atmendriyanam swastha ityabhidhiyate, and treatment has been defined as vikaro dhatu vaishamya samyam prakriti uchyate sukha sangyaka arogyam vikaro dukha mevacha. Although the term cancer may be new, similar clinical characteristics of the disease have been discussed under the title Arbuda. Apart from that, different concepts like Granthi, Apachi, Vidradhi, Shotha, Asadhya Vrana, Sannipatik Asadhya conditions, Dushi Visha, may be correlated. Arbuda is considered as a superficial swelling, Gulma as a swelling situated in deep structure, and Asadhya Vrana as chronic non-healing ulcer. Tridosha and Asadhya presentation of disease can be more associated with malignancy due to their complex nature. Biomedicine now view cancer as a network disease, individual involving molecular networking, signaling pathway, epigenesis, and microbiome science. What classical Ayurveda texts describe in a different language century ago. What are witnessing today, therefore, is not a case paradigms, but thoughtful conversions of system. Ministry of Ayush has been actively fostering these conversions through institutional research and policy initiatives. India has developed structured integrative oncology ecosystem like Center of Integrative Oncology at All India Institute of Ayurveda, Integrative Oncology Unit at National Cancer Center, All India Institute of Medical Science, Jajjar, Center of Excellence for Integrative Cancer Research, Tata Memorial Center, and Arya Vidyashala, Kottakal. Let us consider nanomedicine. Nanotechnology enables a precise delivery of bioactive component, improving bioavailability, reducing toxicity, and enhancing targeted action. Several Ayurveda preparations, particularly bhasmas, have been shown to contain nanostructured particles, and modern analytical tools are now helping us understand their uh, physiochemical properties, biochemical interactions, and safety profiles. Emerging research is also exploring nanotechnology application in medicinal plant to enhance therapeutic efficacy, growth, and disease resistance. Remaining cancer care does not mean idealizing tradition. It means existing scientific inquiry to address complexity through interdisciplinary collaboration, what our Acharya described as Tadvit Shambhasha. Cancer is now recognized as a network disease involving metabolic, immune, and microenvironmental dysregulation, while Ayurveda describes systemic imbalance through disturbance in Strotas, Agni, and tissue and integrity. By integrating system biology with Ayurvedic principles, we advance holistic supportive oncology not as a replacement of conventional therapies but as a complementary framework aimed at reduced toxicology, improving quality of life, and strengthening resilience through Rasayana, immunomodulatory, metabolic, and mind-body approaches. These drugs act through antioxidant activity, induction of apoptosis, that is, programmed cell death, modulation of inflammatory pathway, immune system enhancement, protection against chemotherapy, radiotherapy, induced toxicology, reduction of oxidative stress, modulation of cell cycle, anti-metastatic effect, inhibition of angiogenesis, that is, formation of new blood vessels that feed tumors. Remaining cancer care does not mean uncritical integration. It requires scientific rigor, pharmacovigilance, standardized protocols, safety tools, molecular characterization, and tissue interdisciplinary interdisciplinary collaboration. The future of integrative oncology depends on evidence with oncologist, Ayurveda practitioner, molecular biologist, nanoscientist, pharmacologist, and clinical researchers working together in dialogue, what our Acharya described as Tadvit Sambhasha, and always keeping the patient in the center. Many patients already combine therapies without supervision, creating safety risk. Structured evidence informed integration improve outcomes and quality of life. Achieving this requires a shift in mindset from isolated intervention to multi-dimensional, person-centered care that address biological, physiological, and social dimensions of healing. The future of oncology is not only about stronger drug, but about smarter system, resilience, and restoring balance of the whole person. Thank you. Thank you so much. The 3 speakers are there, and every speaker has 20 minutes for lectures. Thank you.
Thank you so much, Meeta ma'am, for walking us through the importance of the topic. Now we have our first presenter, Professor Katesh V. Katti. He'll be presenting on green nanotechnology and nano-Ayurvedic medicine. Please, sir.
First of all, I would like to thank the organizers of this, one of the very best meetings I have attended in recent years. In particular, the invitations came from Dr. Sham, Dr. Prashant, Dr. Ridhya, and many others. For us to be here, my wife, who is Dr. Kavita Katti, who is also a co-worker, much of the work that I'm presenting today is also co-discovered, co-developed by her. I also would like to thank our chairperson, Dr. Kotesha, today for a very inspirational speech, putting this whole session in perspective. Today, I can guarantee you that I will use all the 20 minutes, maybe plus some more. Today, I'll be presenting some aspects of our research spanning 35 plus years that serendipitously led us into Ayurveda. And in fact, lots of accidents in our life, sometimes they turn out to be very fruitful. And this is one of those examples. So in my presentation, I'm going to dive through how sophisticated nanoscience and nanotechnology would provide a scientific rationale for Ayurveda. One might argue that Ayurveda, discovered 5,000 years ago by Shivshruta and Charaka and their colleagues, might not need any scientific rationale. But I think in the 21st century, we all need to talk the same language of medicine. You will know why that's important. Objectives, this is a requirement of the session. I put just broad objectives, scientific validation of Ayurveda through nano-Ayurveda, which I will show you. And the objective is bridging the ancient wisdom with modern science of green nanotechnology. As nicely mentioned by our chair this morning, how do we enhance bioavailability? Why is that so important in Ayurveda? And we also talk about a whole different meaning for whole body treatment. In the context of Ayurveda, this is the bedrock of Ayurveda. It's not about symptomatic treatment, all of us know. It's about treating the whole body. Extremely important. And there's a global acceptance, but still there are a few things lagging. We collectively, medical doctors and scientists, need to work together to realize this tremendous potential Ayurveda offers to all of us. I will also describe several products that have come through this collaboration. I would say one of the very best industry-academia collaborations from my university medical school. We have a strong tradition of taking discoveries all the way through FDA approval. And we have put several products through FDA approval in cancer imaging and therapy. They're used in every hospital right here in UAE, India, European Union, across the world. So we're using those principles to making Ayurveda scientifically more meaningful. The bioavailability gap, let's talk about it. Mayo Clinic has done lots of work over the years. We have done a considerable amount of work, like that, many institutions. People have thought about using curcumin, they have thought about using tea. But to meet the bioavailability requirement, can you imagine that one has to drink about 10 to 15 liters of tea decoction, or one has to be ingesting 50 to 100 grams of curcumin per day? That's impossible. That causes toxicity due to the phytochemicals itself. That's the requirement. If you did not do that, these phytochemicals would not be bioavailable. If they're not bioavailable, the very intent of using those phytochemicals, Ayurveda formulations, for treating diseases would be defeated. How do we solve this problem? It's an important problem. Ayurveda has told us that these phytochemicals can treat diseases. Unfortunately, Charaka did not publish a peer-reviewed publication that we all can go and refer. How many grams, how many milligrams, for what disease, for what cancer. We need to collectively decode that. That's the whole idea. In my lecture, in addition to our pursuit of decoding Charaka, we're also interested in introspecting. Ayurveda, as all of us know, I would be preaching to the choir here, the concept of medicine to our planet did not start from Western medicine. I want to repeat that. The concept of medicine was given to our planet by our ancestors through Atharva Veda. Sometimes we forget that. If that is a fact, but then the question we all need to collectively answer, perhaps introspect. There's no simple answer here. The question that we need to introspect is, if Ayurveda was discovered 5,000 plus years ago, and if Ayurveda is the very basis of medicine to our planet, why in the world less than 1% of the global population uses Ayurveda as a first-line treatment? That's an important question. If we can dive deep into that question and see how we can really bring about the potential of Ayurveda, it helps not just Ayurveda, it helps the field of medicine. And that's part of the reason why there's a lot of interest. There's a lot of interest in bridging this broken bridge. Western medicine, as all of us know, we call allopathy in this part of the world. That is the first line of medicine. And we all collectively refer Ayurveda as an alternative medicine, although Ayurveda gave the concept of medicine to this planet. It is a misnomer, in my opinion. We need to come up with a completely different terminology. It is Ayurveda that gave the concept of medicine. Why in the world we continue to refer Ayurveda as an alternative medicine? And there are reasons. We'll go through them. And we need to build this bridge. Why? This bridge, by the way, cannot be built by mortar and cement or steel. It takes an intellectual cement to be able to build this bridge. Building this bridge is important because it benefits patient community. There are many, many, many diseases that would require combination of Ayurveda with English medicine. Right now, medical doctors across the world, they do not have the luxury to co-prescribe Ayurvedic medicines alongside allopathic medicines. We're not doing that, actually. We got to be doing that. Just look at the recent pandemic. Had we had the luxury of Ayurveda to a predictable level of allopathy, we could have saved millions and millions of lives. We didn't have that luxury. So that's why we need to build this bridge through interdisciplinary research, as beautifully pointed out by our chairperson. We need to start working outside the box for making Ayurveda universally relevant, universally acceptable. NCI, along these lines, the world is coming together now. National Cancer Institute, I was talking to one of our speakers this morning. They conducted the first ever workshop with a focus on Ayurveda. It is a workshop jointly conducted by Ministry of Ayush in New Delhi, along with National Cancer Institute, which is a branch of NIH. It's all happening. Several of us spoke, and the whole idea was to introspect. What is haunting Ayurveda? Why we are not able to realize its tremendous potential? As we discussed a few minutes ago, the bridge to cellular delivery. Why is that so important? We can't treat diseases anatomically anymore. That's not how medicine would work. That's not how medicine would have worked in the past. But better late than never. Now we know our approach has got to be cellular, because all the tumor biological microenvironment, all the PD-1, PD-L1, everything is happening at the cellular level. If we design drugs that don't penetrate tumor cells or other cells, we would be doing a disservice not just to the field, we would not be saving human lives. That's happening. So, can we translate Ayurveda to be cellular? If we can answer that question, I think we can take Ayurveda to a level where it belongs to. The same thing here. as I already pointed out, curcumin, a tremendous potential, but we are not able to use its advantages yet. The approach what we developed, rather than reinventing, let's look at the profoundness of Ayurveda by collaborating with Ayurveda doctors. This is a slide I prepared for the G20 summit when Prime Minister Modi had invited me. And I addressed the audience consisting of scientists, engineers, Vedic experts. It's important, of course, Ayurveda experts. This slide is important because there is so much known in Ayurveda, we don't have to reinvent. We will never be able to reinvent. The profoundness and the knowledge of Charaka, it is unparalleled. Let's collaborate with Ayurveda doctors, all of your experts here, and then apply scientific principles, inject science and technology into what was known. By doing so, we'll start developing reproducible Ayurveda formulations. Right now, there is a problem. Products made in India cannot be possibly reproduced in Africa, Brazil, United States, European Union. We need singular formulation processes that are fully reproducible. Once we reproduce, let's try to understand mechanisms of action at the cellular level, at small animal level, human mimicking animal levels, means monkeys and dogs and pigs. Yes, pigs do mimic humans in the context of medicine. Once we have understood all of that, we can define the doses, we know the mechanisms, then we can go back into humans and start using these formulations into humans. So that's the concept. This concept really is based on this particular discovery, what I'm showing here. This also tells the profoundness of our ancient wisdom. Charaka did not publish, as I said. He knew almost every Ayurvedic herb, whether it is leaves, flowers, roots, they are reservoirs of electrons. Yes, they are reservoirs of electrons. Why is that so important? What Charaka was doing, he was taking a cocktail of herbs, mixing with minerals, and giving it to people with the different diseases. I think he was doing the right thing. Why? The human civilization did not get wiped off due to various diseases. We're all here, hard and healthy, which means what Charaka was doing, he knew the science and technology of that. Unfortunately, we don't have the luxury referring to his notebook. Such a thing doesn't exist. So this is our first step to decode what perhaps Charaka was doing. He was mixing these electron-rich phytochemicals. Dr. Kochar referred very beautifully yesterday, antioxidants. Antioxidants for physicists, chemists, and engineers means that these are molecules rich in electrons. When you interact these electron-rich molecules with gold precursor or silver precursor or copper precursor, you actually will produce nanoparticles. If you buy Swarna Bhasma from 10 different sources and apply electron microscopy, you do see nanoparticles. 1 to 2%, the best one so far is 5%. And we have published, numerous other research groups have published. The question is, how about we translated these Swarna Rasayana, Rajata Rasayana, Tamra Rasayana, as close to 95, 98, 99% nanoparticles? Why not? Let's check it out. Would that improve the bioavailability? So this is our process. We patented it. Lots of people didn't believe it. Everybody thought, we scientists, we know that one of our problems is we get excited, we jump to publication, and the whole game stops. But we didn't stop there. That's a clinical translation culture we have in my institution. We went ahead, scaled it up, every single one of these formulations. Not just these, we have 500 plus similar formulations with all Ayurvedically relevant herbs. We have translated them into Swarna Rasayana, Rajat Rasayana, Tamra Rasayana, and all of that. I would like to request all of you to visit N34. It is a Kadamba company which has licensed all our patents here in India, and they are developing cancer therapy, cancer diagnostic, products for treating diabetes and all that. The point is, these are industrial scale Swarna Rasayana processes. Likewise, we have Rajata Rasayana. And now I will switch gears. Again, I want to, pat on the back of Ayurveda. I also want to, remind myself why we did not inject science and technology into Ayurveda. This field, in my opinion, has been begging from all of us, give me science and technology, I can revolutionize medicine. Literally, that's exactly what this field has been begging from all of us. We can see that actually. We have examples of gold nanoparticle-based, Ayurvedically encapsulated formulations that are perhaps the best IL-12 promoting drugs on the planet right now. It's a very powerful statement I'm making. I'm cognizant about what is happening at the NCI, what are the clinical trials that are taking place to promote IL-12 in the body. Everything is explained here, why IL-12 is important. It's important, it is a panacea for almost every disease, including cancer. I'll quickly run through one example. Kadamba tree occludes cadambine. Look at the beauty of this molecule. Cadambine has this glucose backbone. I don't think this display can be properly seen. And this glucose molecule, look at the beauty of the nature or Ayurveda. This glucose molecule will take this therapeutic cargo directly to the tumor cells. But by giving kashayas made out of this kadamba tree, would not treat any disease. Maybe anecdotal evidence. But for us to make this whole therapeutic cargo bioavailable, we need to embed these things on nanoparticles, and that is shown here. This is the approach, green nanomedicine approach. Through this approach, as I just now told you, all of you, over 500 combinations we have developed, and every process goes through the highest level of quality control, whether it is electron microscopy or X-ray diffraction or ultraviolet spectroscopy. Every single technique needs to be applied. That's the only way we can claim to the whole world formulations here in UAE can be reproduced in India or in Europe or in the US or in Brazil or in South Africa. And we have done that now. It is working. Why do we apply nanotechnology? We have been talking about nanomedicine. Nanotechnology, of course, reduces the size to 10 raised to minus 9 meters. When it is of that size, we can penetrate the cells. Cells are 15 to 20 microns in size. More than that, I can amplify the therapeutic cargo on nanoparticles. For example, cadambine, I can put as many as shown here, 8.8 into 10 raised to 5 molecules of cadambine, 7.6 into 11 molecules, 10 raised to 11 molecules of cadambine on a single nanoparticle. This is not a hypothesis. These are the rules of physics. If we get 10% of the therapeutic payload on a nanoparticle, we would have created one of the very best IL-12 modulating drugs in the world. That's exactly what I'm going to show you, the evidence. So the amplification of therapeutic payload that we can achieve through nanotechnology, it is simply not possible by any other scientific means. Again, look at Charaka, I think, knew that. That's why he was mixing cocktail of herbs with different minerals. By doing so, now we start probing the cells. The evidence is important. If we probe the cells, we can achieve whole body treatment and hemostasis. Achieving this hemostasis balance is important because all of us want to be healthy. If you want to be healthy, we need to be on the left side of this chart, where we have more of IL-12, we have more of IF and gamma, more of M1 macrophages, which actually are checkpoint inhibitors, natural checkpoint inhibitors, and unhealthy patients unfortunately manifest these attributes, more of IL-6, more of IL-10. So our drug, when applied to a tumor patient, should tilt the balance towards this. That's the evidence I'm going to show through nano-Ayurvedic medicine. Why do they target only cancer cells? They target because certain phytochemicals that are defined in Ayurveda, we have done all the displacement assays for a short of time. I'm not going to show that. They target the tumor cell receptors. They're very specific to tumor cell receptors. Do they go to the normal cells? Of course, some of that, these ingested dose goes to the normal cells, but normal cells have significantly fewer receptors. That means the odds of the administered dose going to the tumor cell is more than 98, 99%. A small amount of the drug goes to the normal cells. They have the repair mechanism, and it does not lead to toxic side effects. So do we have more evidence on that? Yes. Here is this is the depiction of the size. Tumor cells allow a porosity of about 300 nanometers. Most of the allopathic drugs, as well as Ayurvedic drugs, their size, if you measure, they are more than 300 nanometers. No wonder they don't penetrate the tumor cells. If we created drugs of the size as shown here, 35 to 55 size, 35 core size, about 55 to 60 hydrodynamic size. What does this mean? What is this size? We have top scientists here, Dr. Prajna, Dr. Medha, Dr. Kavita, of course, our Chief Medical Officer, Dr. Vijay Kumar, who is using these concepts, already treating patients successfully. I would urge all of you to meet with them and ask those questions. You can ask me, but I don't have time. Yeah. Okay, that's how to avoid some questions. Well, this is not a cartoon. This is the actual picture of what happens when you incubate these nano Ayurvedic medicine agents with tumor cells from prostate tumor patients. You have hundreds of nanoparticles per cell. It is an electron microscopic picture. These are cells, breast tumor cells before incubation, breast tumor cells after incubation. You can see every breast tumor cell has abundance of these therapeutic gold nanoparticles. This translates into spectacular therapeutic efficacy. Before that, I will just show you our agents by default, our nano Ayurvedic agents by default, they serve as checkpoint inhibitors. Can you believe that? Not only do they produce abundance of IL-12, which is a therapeutic cytokine, they also address this important gap that has existed in medicine, not just in Ayurveda. Even the allopathic medicine is struggling. Their IL-12 clinical trials, every single one of them has failed, those of you who are following it, because they're highly toxic. Our IL-12 promoting nano Ayurvedic medicine has no toxicity at all under certain doses. Dr. Vijay Kumar can tell you thousands of patients he has treated with no detectable toxic side effects. Why? Our approach also targets the macrophages. It promotes anti-tumor M1 phenotype. That's why I keep telling these are natural checkpoint inhibitors, and that's why they promote anti-tumor response very successfully. This is, just a couple of more minutes. This is a data just to show you nano Ayurvedic medicine's capability to enhance IL-12 in the body. It enhances 580-fold as compared to the FDA-approved product 320, but this product is highly toxic. And just the Ayurvedic herbs, they do have the capacity to enhance IL-12, but very insignificant. This should give you an idea why we should go through the nano approach in achieving efficacy in saving patient lives. This is an example, self-explanatory. Cisplatin, a workhorse of Western medicine, destroys tumor cells and normal cells indiscriminately. That's why it destroys the immune system of the body. Nano Ayurvedic medicine products, as shown here, no effect on the normal cells, a small amount of turnover, which is natural. That means that there is no systemic toxicity. There's no systemic toxicity, particularly in the context of targeting the kidney. Most of the Ayurvedic drugs, particularly Swarna Bhasma, we have analyzed Swarna Bhasma from different companies, regulatory agency, project we had. They target kidneys. Our approach, what we did, we created the first ever radioactive Swarna Rasayana. We use radioactive gold. Why? If we administer that to the animal, we can count the radioactivity in all the organs in the body and then show to the world when you translate Ayurvedic formulations as nano Ayurvedic medicine, there is no fear of kidney toxicity. This evidence we have for almost every formulation. Yeah, almost done. This is the clinical trial. With this, I'll finish. This is the clinical trial data on triple-negative breast cancer patients. These patients had gone through chemotherapy, radiation therapy. Several of them had less than a month of survival. This is the result of a 90-day treatment of our nano-Ayurvedic medicine alongside doxorubicin. You might say the tumor burden is reduced by 10 to 15%, but actually when you compare the second group of patients where they were administered only the FDA-approved doxorubicin, the tumor burden went up by multiple folds. When you compare this, the effect of nano-Ayurvedic medicine with the chemotherapy alone, the effect is tremendous. It can save human lives, and it continues to save human lives. Yeah, 1 minute. We have the first ever patent on nano-Ayurvedic medicine. We have a series of patents on this new modality. It's Ayurveda, except that we use green nanotechnology. I discussed all of this. There are many products from this approach. It is not just cancer therapy, wherever anti-inflammatory treatment is required. All of these products are developed through Ayurvedic techniques using green nanotechnology. I think I have convinced you that we're able to build this bridge. This bridge will save patients, whether they're in India or any other part of the world. With that, I would like to conclude. These are the references I've used. And lots of people to thank. Foremost, I would like to thank Dr. Anantkumar Hegde, a visionary who is responsible in bringing these technologies to India. Otherwise, they would have gone to some other pharmaceutical company in some other country. So his inspirational leadership has brought these technologies to this part of the world, funding agencies. I know you will have questions. Now we have taken this treatment, nano-Ayurvedic treatment, across the world. With that, again, I would like to thank you. My apologies for this extra time. I had forewarned you.
Thank you so much, Professor, for your enlightening and thought-provoking session. If we had time, we would have listened for you to whole day. And I invite our next presenter, Dr. Jannatul Firdaus, on evidence-based systems biology in Ayurvedic oncology. Please, ma'am.
Namaskaram. Respected dignitaries, esteemed delegates, and dear colleagues, I am Dr. Jannatul Firdaus, an Ayurvedic physician and a clinical researcher from Kerala, India. My presentation is not on my research papers based. It is my clinical perspective and what I have experienced in this 30 years of my practice, about 10,000 documented cases in cancer and other indicated disorders. My work focuses on translating classical Ayurvedic principles into a structured, repeatable, and regulatory aligned framework for oncology. We Ayurvedic peoples are always questioned by there is no repeatability in our science. But here, what I find in my clinic is with repeatable parallel outcomes. This model is designed to support patients across entire continuum of before, during, and after conventional therapies for cancer. I arrived at this framework by viewing cancer not merely as a tumor-centric disorder, because the basic definition of cancer is always we heard that abnormal growth of immature cells. But there is a reason beyond this. That is the systemic aspect. My goal and contribution are to enhance biological resilience, improve treatment tolerance, and ensure long-term survivorship. Even if the patients survived cancer, but their quality of life we see very poor. Here my objectives are, one is to evaluate the strength and limitations of conventional modern medical treatment, and as well as when we use standalone Ayurveda, there are some limitations. That is my objectives. Next. To understand oncology, let us briefly look at conceptual origin of cancer. This is the regulation, resilience, and repair. Genetical, epigenetical, and environmental factors come due to this dysregulation, dysresilience, and lack of repair due to the conventional medicine. That is the future of Ayurveda in cancer. Next. Here, we can see the importance of Ayurveda in cancer, why we Ayurvedic people should treat cancer. This is an important question. In 2022, there were nearly 20 million cancer cases worldwide and about 9.7 million deaths. That means more than 50%, about 50%. Despite remarkable technological progress, and this burden continues to rise. This is not a question of whether modern medicine works. No, it works. It does work, but there is a gap. Ayurveda is there to fill that gap. That was the slogan of 2023 in WHO. All these achievements of modern medicine we respect. However, as emphasized by WHO, significant care gap still exists. While survival has improved with modern medicine, we increasingly see treatment-related toxicity. That is the worst aspect of conventional modern medicine. And the other one is immune suppression. Most of the people, common people, they hear about immunity or immune boosters. The idea is different. But immune suppression causes many other diseases. This immunity, not like the common people thinks, it causes the suppression and other diseases. That is a burden again arises due to cancer. Here in this also you can see what is going on in global cancer burden. It is, the trajectory is increasingly each year. It is increasing. By 2050, we expect 35.3 million cases and 18.5 million deaths. That is really a fearful aspect. Next. Rising incidence shows that the current model alone is insufficient. These are the trajectories shown in different areas of world. In all the globally, in every place, it is increasing and not decreasing in spite of all technologies and researches in cancer. But I think one reason for this is researches are going on one side, but approval is on another side. But in Ayurveda, many people, common people all over the world knows what Ayurveda does. But still they doubt how it is clinically, how it is happening, and what is the aspects of in clinical. That's why I present this in clinical aspect. Next. Here we can see the limitations of conventional therapy. When we look at cancer care today, there are different groups, high drug effect and no drug effect and side effects. This is mainly due to the different people act with the different medicines differently. That is the reason. But in Ayurveda, when in clinical practice, we find the prakriti of patients and this can be reduced. This wide variability tells us one thing, that is one standard model is not there in cancer. Different people and their aspects, everything has to see. Next. In modern science, always we hear that early detection, even cancer affected people, think that early detection is the golden rules. Even doctors as well as the researchers think early detection is the golden rule, but it is not a prevention. Once cancer is affected, patients are more prone to secondaries and metastasis. A true prevention requires an host system that biologically prepared to respond the treatment. This body, if not biologically prepared, this early detection is nothing, I could say, in my clinical practice. Because many patients come and ask me, doctor, I have seen cancer at the early stage and I have done everything, all protocols I have done, still I am at this end stage. How come this is? Because they follow all type of medicines, conventional treatments, and everything else. And even all type of whatever they know. But their bioavailability may be different. And so this early detection, I say it is needed and it should go with host resilience and we should prepare the host to accept whatever the medicines or whatever the system or whatever the care they follow. Next. Here, in this scenario, systems biology emerged. Systems biology is not new to the world. In Ayurveda, surprisingly, it has already mentioned. But in 1948 onwards, there was a thinking about the systems biology. System biology emerged to address these limits of reductionism. Reductionism in the sense, which body is affected and treatment affected and the system, and it is focused on that organ. That is, but this organ is in host, but this host has to be controlled. Treating by body parts as isolated organs rather than an ecosystem. Surprisingly, Ayurveda has already functioned on this. This integration is about bringing this knowledge system together. The adapting of Ayurveda is not new to science because in Sushruta, example, Sushruta laid the foundation of surgery and modern medicine refined and with precision and technologies. Same way, we must approach integration. All the presentation in this World Ayurveda Congress is for that. What Sushruta bring, he is the father of surgery, and it was not known to that period to the entire world. But Sushruta bring it and the precisions and whatever technologies are emerged, now reached, even if it is in modern medicine, it is reached the highest position in surgery. Same way, in Ayurveda should integrate it from here with the systems biology framework to see the body as an ecosystem and each cell has potential to be a new organ, means new person. Next. Here, I'm going to present a case study. It is not just as a testimony, because in science we know testimonials are not important, but here it is to demonstrate this, whatever I have told is not an ideology. It demonstrates beyond the theory in real world experience, because we need real world experience. To move from this theory to real world experience in clinical reality, here I am sharing the case of a 9-year-old boy. He is presented with recurrent medulloblastoma. This medulloblastoma is globally recognized as high-risk pediatric tumor. The child had undergone gold standard of diagnosis. This diagnosis and treatments, chemotherapy, radiation, surgery, and they have put under vision. All these are the developments from modern oncology. The care was exemplary. Still, what happened? However, the post-surgically, the treatment, the child's condition started to deteriorate rapidly. This was not a failure of modern medicine. I tell it again, is not the failure, but it is the boundary of tumor-centric model. There comes the importance of biological framework and Ayurveda as a network medicine. As presentation, the child was in coma with critical abnormal organ parameters. Here you can see the platelets, hemoglobin, bilirubin, and everything, abnormal organ parameters, hemograms, and hydrocephalus. And the family was advised that no further therapeutic options remained, and hence to take the child back home. Such cases need Ayurvedic support. In the integrative intervention, we faced, in this case, dual challenges: drug delivery system and system regulation. Because the patient was in coma, all veins were collapsed, we could not give any intravenous medicine. We utilized 2 primary alternative routes and 2 other secondary alternative routes. One is interventory system, because no other route, so I developed the transdermal delivery enhancement with absorption catalyst. That is important. When we give medicines or LEPA, there needs catalysts. Catalytic absorption is needed. It is a well-known principle recognized even in modern pharmacology. The other was rectal administration. That is well known in Ayurveda as Vasti, the Adda Chikitsa. Here Vada is important dosha because Vada Pangu, Pitta Pangu, we know that sloga. It is an effective system of absorption even in critical care in modern research. Sorry. And Nasya and Anjana also used later. Here we shifted the focus of killing a tumor to supporting the host system because there is no other way to treat this patient. We address the collapse of dynamic or functional regulatory intelligence to restoring immune metabolic resilience. That is the function of Agni, we know, and after the restoration, what would be the result? It is the Ojas. Ojas is one of the subjects we have to talk hours. And another thing was neural signaling network. Neural signaling network we can consider as, as the network of it is Indriya and microenvironment, removal of toxins and toxin burdens. And I also applied chronobiological principles of Ayurveda in this case and for the drug delivery, because drug delivery was very important and it would always remain a challenge in such critical cases. Next. Here, next. Here I have seen this, some cases I have written due to the lack of time. I just put some cases over here to say that it is not an isolated case. Many cases are, this is another case, next. It involves pattern recognition. Many cases are the next. It involves pattern recognition. In this pattern, we see the repeatable pattern. Structured treatment with, here it is to, I put this for credentiality because it is logical and classical. And historical references are there with all cases. Next, this is another case. And here you can see a pancreatic case with both I have written in. Next. These are the other cases and treated in our hospital. These cases presented here with patients treated in our hospital to ensure transparency. We have classified outcomes using a simple clinical grading system. 1+ indicates no objective disease response, but in such cases, appetite, sleep, and relief from constipation will be very important. Here I had written the +2, +4, +3 in that representation. 3 plus shows improvement in both clinical symptoms and investigation findings. 4 plus represents patients who lived beyond the expected short prognosis with good quality of life. 5 plus indicated long-term survival with sustained well-being. This type of case I have presented and documented about 10,000 cases. Next. This is the case distribution I have treated in our hospital. This graphic presents the distribution of cancer cases, and a higher proportion here you can see in brain tumor cases reflects our early clinical focus and referral pattern from different areas. That means this much patients are coming to Ayurveda from all over the world because they need Ayurvedic treatment. This is the gap of modern medicine, not because it is not effective. A significant proportion of these patients presented at advanced or end stages, or as dropouts from conventional treatments due to toxicity, one reason. The other is cost and limited tolerance. Many medicines cannot tolerate to the patients. This pattern highlights the growing dependence on Ayurveda and integrative care across all the stages of cancer and the clear need for collaborative models. Here, I invite collaboration and scientific research in Ayurveda and with the integrated aspect. These are the cases treated, these are the cases I have treated, not the full outcome. The data reality of hospital records shows that clinical reality often precedes research framework. While RCTs are the gold standard, they alone are insufficient to study complex biological ecosystem. If the absence of RCTs means absence of truth, the patient would not be alive. We need research work in a different way for our network medicine. Because if we wait for RCTs, what would happen here? This is the importance of what Saraga and Susruta gave us. Next. Our treatments here, this is the treatment strategy. Our treatment strategy is based on single core principle, systems equilibrium. We can call it Tridosha or whatever name, but it is better to not go for that terms because the world is unknown about these terms because it is very deep meaning it has. When Ayurveda is viewed through systems biology framework, clear modern parallels emerges because the word systems biology is new and it is modern, and so in that terms we have to convert this. Through Shamana, Shodhana, we address what modern science described as metabolic regulation and pathway modulation. Samadosha, Samadhadu, Samakni, we know what it is, says. Due to the lack of time, I'm not explaining all those things. Next. But this is the next and before previous. Here, this side is the Ayurvedic aspect and the other side is modern aspect. This has the clear parallels. And it is nothing empty in the nothing is missing. It's clearly what we have treated and the principal correlation and parallels for integration. Next. The area of integrations are, we operate across three critical, these are the network medicine, surgical advancement, chronobiology. Chronobiology is very important because in many of my cases, I used to give medicine from 2 a.m. to 6 a.m. This chronobiology is very important, and the regulation of sleep cycle and appetite, it is very important. Next. And metabolic reprogramming, psychoneuroendocrine immunology, tumor microenvironment is another area what we have treated. And I find direct results with the tumor microenvironment by Shodhana, different type of Shodhana. And Rasayana is the most important treatment, and it is not a last treatment, but we can go. Means with the chronobiology is applying properly, Rasayana can give according to that timing. Next. And here, the strategy of integrated treatment. Here, integrated strategy is not replacement, but a synergic partner to modern oncology. By intervening before, during, and after surgery, chemoradiation, we provide continuous protective shield that optimize recovery at the stage of patient's journey. Next. Cancer is not about killing the disease. It has three dimensions: physical, mental, and spiritual. Here we can say, in a scientific presentation, spiritual word we can convert it into idiopathic aspects. But, here, this is the method. Physical is metabolic, genetic, and environment. Mental, prajnaparada, and spiritual aspect, lack of self-awareness, and many other idiopathic factors are there that we can discuss maybe in different other stages, maybe. Life after treatment, physical, mental, and spiritual, social being is important. In autonomy also, these unknown factors are there that we can come under the spiritual or existential area. And the other thing is things are make them audiorogi, presenting the patient to prepare a host. There is audiorogi is important. Audio means not being economically important, but sadguna sampanna. That is, he or she should be very moral values we have to teach in many cases. Because patients lives within beliefs, values, and meaning. Scientific and cultural, spiritual aspects are there. Ignoring these aspects does not make medicine more advanced. This I have seen in my patients, but it makes, ignoring these areas, makes it incomplete. It never makes medicine more scientific. The two integration restores biology, dignity, autonomy, and create not just survival, but a person to the society. He or she has to come back to the society with his life. Next. In cancer, one of the main factor is fear. Fear, cancer, the word itself is fear, and it is treatment also another fear. And treatment is a tragedy always, most of the cases. And economic burden and social stigma. This social stigma we have to admit and we address with integrated medicine, and its importance is increasing. Because patients, even in the social media and through that very, means another knowledges, untrue knowledges, they are burdening with those knowledges. Next. Here, the yoga and meditation. Yoga and meditation are not adjuncts of belief. They are evidence-based mind-body interventions. To summarize this, finally, Ayurveda represents life intelligence. We say it is knowledge, but it is intelligence. It is the intelligent life. And it stands among India's greatest scientific contributions to humanity, ready to integrate with postmodern research and systems biology. At this contest, I say, for policymakers and for collaboration, I say Ayurveda deserves a seat at the global oncology table. When life are at stake, integration is not an option, but a responsibility of every scientifically oriented mind. This work I humbly dedicated to generations of Vaidyas and teachers who preserved, practiced, transmitted wisdom to Ayurveda. Thank you.
Thank you so much, Doctor, for walking us through her excellent clinical expertise. Now, I invite Dr. Pratibha Shah for her presentation.
Good morning. Is everybody awake? So I want to begin by thanking the organizers and assuring the audience that I will try to stick to my 20 minutes so you can all be free soon. It's difficult to come last, and I'm preceded by excellent presentations. I want to start by thanking our chair, Dr. Kotecha, who has really made excellent points in her opening statement. My focus is going to be on integrative oncology, and I'm going to try and highlight from where I live now. I live in USA, so my presentation is going to be slightly conservative, as you will be able to see. So I'm going to give an overview of integrative oncology, the Ayurvedic framework, and the intersection of Ayurveda with the IO goals, evidence of role of Ayurveda in various phases of cancer treatment, identifying some of the barriers and challenges to integrative oncology, some future directions and optimistic takeaways. So what is integrative oncology? Integrative oncology is a client-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. This is the technical definition found in integrative oncology portals. Integrative oncology aims to optimize health, quality of life, not just survivorship, but optimize health and quality of life and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. So in Ayurveda, always the focus is on the rogi. Yes? Do we all agree? And that is a major difference. I think Dr. Kotecha and our preceding speakers also highlighted that the rogi needs to be at the center of the treatment. And we are heading towards precision treatments, but we also have to remember that the microenvironment actually feeds on the macroenvironment. Do we all agree? Because microenvironment does not exist in a vacuum. It is connected to the macroenvironment. So we must keep that in mind. And also, an excellent point was made about evidence. And I think we need to really remember this when we talk about evidence. What is evidence? Evidence is not just randomized clinical trials. That is the gold standard, but we should not try and fit Ayurveda into RCTs. We have to fit what evidence can do justice to a system like Ayurveda. Do you all agree? Right? And this is really critical because how we define evidence will inform how we are going about collecting that evidence. And what happens when we aim at RCTs as a gold standard, we miss out on the complete framework of Ayurveda. This is something we need to remember. In our pursuits for RCTs and data collection, we should not forget what Ayurveda is. This is really, really, really critical. And then also we need to remember that there are countries in the world that are still very resistant to the idea of holistic medicine. But one good news I want to share with all of you, that in USA, 2 years back, under National Institute of Health, NCCIH. How many of you know NCCIH? National Center for Complementary and Integrative Health. They have introduced, please listen carefully, they have introduced a whole person research coalition. This is a new initiative, whole person research. This is what we want. And this is what is coming from US for us. And I'm very proud that one of my non-profits was invited to be part of the coalition. And we are part of the 80 organizations now. And I actually attended the launch of this coalition in person. So whole person is what we need to focus on. I would like to emphasize that many times during my presentation, because the whole person is who is important. Rogi versus Roga. That is non-negotiable. And that will define how we are approaching cancer. So very important. So as you can see, the integrative oncology aims to empower people to prevent cancer and become active participants before, during, and beyond cancer treatment. It's not just about taking targeted therapies for cancer alone, but what actually causes cancer. Till today, from Western medicine standpoint, we don't have a clear understanding. Yes, we don't know what causes cancer. There is a tipping point in a person's health, right? Where the natural intelligence of the body, the buddhi, what we call, is lost, okay? And there is an uncontrolled division of cells. That is what happens. And that we cannot talk only in terms of microenvironment. We have to keep in mind the macroenvironment, which is the whole person. And Mayo Clinic's example was given. So Mayo Clinic is one of the centers that is leading in integrative oncology. So their comprehensive cancer center offers integrative oncology to address symptoms caused by disease and treatment such as fatigue, pain, nausea, anxiety, and others. This practice combines conventional Western medicine with evidence-based complementary systems. So far, the evidence base has been primarily based on data, not the whole person approach that hopefully will be integrated in future years. That means the treatments have been researched and proved to be safe and effective in healing. I must clarify that this is limited to just Reiki, for example, or yoga, things like that, or meditation, nothing that goes inside the mouth. So this is what you need to clearly understand about the integrative treatments so far. Complementary treatments may include mind-body practices, lifestyle changes, dietary changes, natural products, and more. What are the core goals of integrative oncology? To optimize quality of life, manage symptoms and side effects, support immune function and recovery, empower client participation. I'll continue to highlight that. Rogi, empower client participation. You must listen to the client. Enhance clinical outcomes. That's non-negotiable. Provide evidence-based support. Now let us look at the Ayurvedic framework quickly. Some of it has already been highlighted by my previous speaker. So, and Dr. Kotecha also highlighted our Ayurvedic framework, the dosha framework, the functional equilibrium, the prakriti vikriti, disease being understood as a progressive disruption of homeostasis. Nothing happens overnight. It's a progressive disruption of homeostasis. Digestion and metabolism, Agni, I think you all agree. Agni is central to disease causation. Tissue integrity and prevention is foundational. Swastha se swasthya rakshanam. Everything that goes into it is of primary importance. So all the chronobiology we talked about, diet, daily, seasonal routines, lifestyle alignment, and the personalization of therapeutics. Here again, I have written in red color, the Rogi versus Roga again, because this is really, really important. Now let's see the intersection of Ayurveda with integrative oncology goals. And as you can see, again, my previous speaker also had a comparison. You can see on the left-hand side in the second column, the description in Ayurveda of health of individual prakriti, of disease as a progressive imbalance, and what is the conceptual correlation in Western medicine. I will not be going over all of it. Now, just a few examples of evidence. Again, as I had stated right in the beginning, I'm going to be sharing with you a very conservative approach because I live in United States and we have a lot of restrictions. So this is more chemo preventive and chemo targeted, etc. Those kinds of herbs and examples. So before we go into that, some of the common side effects of chemotherapy, as we know, are fatigue, nausea, vomiting, hair loss, mouth sores, taste changes, blood count change, neutropenia, thrombocytopenia, etc. And if you just focus on nausea and vomiting, one of the common herbs is ginger, as you can see. And there was a study done in 2012 on 576 clients. I have removed the word patients because we can't use that word. And this was done in Rochester Community Clinical Oncology Program, and 70% of patients receiving chemotherapy report vomiting and nausea, and that is why this intervention was chosen. And the methods were that any patients who were going to be receiving at least 3 additional cycles of chemotherapy were eligible. That was the inclusion criteria. And what was given was placebo, 0.5 grams of ginger, or 1 gram, or 1.5 gram of ginger. So there were 4 arms. And all patients received 5-HT3 receptor antagonist antiemetic on day 1. That was standard. But thereafter, they took 3 250 milligram capsules of ginger or placebo, a combination to reach 0.5, 1 or 1.5 gram dosage for the first day of the next 2 cycles of chemotherapy. Patients reported the severity of nausea during their morning, afternoon, evening, and night on a 7-point semantic rating scale, where 1 stood for not at all nauseated and 7 for extremely nauseated, for days 1 to 4 of each cycle. The goal was to determine if ginger was more effective than the placebo. And you can see the p-value is very significant for what they found as an analysis on 576 patients. They did a mixed model analysis that demonstrated that all doses of ginger, all doses, 0.5, 1, 1.5 gram, they were effective in significantly reducing acute nausea severity compared to placebo on day 1 of chemotherapy. P-value is 0.003. So this is statistically very significant. And now let's see Tinospora cordifolia. And you can see this is a very recent publication. So you can see the background that hyperactive neutrophils, this is a proliferation mechanism through which different organs and systems in the body get infiltrated with high accounts of neutrophils. And therefore, taming of neutrophils via potent immunomodulators could be an appropriate therapeutic approach. And Tinospora cordifolia, which is Amrita in Ayurveda, right? That is a synonym. That was chosen. And you can see it was an in vivo study. And the lymphoma was created by using the murine model. And the extract of Tinospora cordifolia was given. You can see the dosage. And you can see that neutrophil infiltration was seen to be either prevented or reduced. And there were other systemic effects. So you can see the neutrophil hyperactivation was ameliorated. There was downregulation of many, many negative biomarkers. And you can see that, I'm just trying to go fast, you can see that different systems were restored in case they were impacted. So system-wide, while we talk about nanotechnology, we should also not forget about our single herbs, our classical formulations that change the microenvironment, which in turn changes the microenvironment. I think we should remember that too. Now, a few more examples as chemopreventative and chemotherapeutic. Triphala, I have taken very simple examples because these are permitted in my country. These are considered as herbal or nutritional supplements, so we are allowed to use these. This is again a recent study in 2020, and Triphala has been used for centuries, we all know. You can see this is a meta-analysis basically. You can see there are so many molecules, bioactive components of Triphala, and the list is long. This is the beauty of Ayurveda. A single herb can have multi-system effect, and simple formulations can also have multi-system effect. And again, we need to remember that the genesis of cancer does not happen isolated. It comes systemically. This is really important to remember. So the list is very long. I obviously will not be able to take you through all of it, but you can see it destroys cancer, and it is also preventive of carcinogenesis. Now, also targeting. If somebody is going for chemo and radiation therapies, how can you improve the targeting of tissues so that the normal healthy tissues do not get destroyed? Only the cancerous tissue is targeted. So a lot of natural compounds have been studied. There is actually vitafurin and curcumin as well. And then some specific Ayurvedic phytochemicals in cancer treatment. You can see here on the right-hand side from Vasa, Amalaki, Giloy, Ashwagandha, turmeric, Kalmeg, Tulsi. Tulsi is very, very important. It's very well studied actually, as well as neem. Lot of phytochemicals have been found to be very effective in cancer amelioration. So these are some of the barriers we all know. We talk about lack of evidence, but again, I will emphasize, I think we need to be very clear about what does evidence mean to Ayurveda. Instead of fitting Ayurveda into evidence, we have to create a framework of evidence that fits Ayurveda. This is really important. So far, we have been struggling with that because you cannot do RCTs justifiably on a system like Ayurveda. But even with single molecules and single herbs, there is ample evidence. The problem is integration is not happening. I have shown a lot of examples. Again, I use the word examples because it's a lot more, but integration has not happened. We need stronger advocacy, government leadership, strategic collaborations, and continued scientific studies. NCI is opening its doors. Dr. Katti mentioned, and I personally have also seen them very open now. Dr. Jeffrey is very, very open to what we call complementary and alternative methods. So some of the takeaways, I talked about the Whole Person Health Research Coalition and concepts such as cellulogenesis. We never talked about it a decade before, but now we are very frequently talking about cellulogenesis. It's being appreciated and talked about, the various omics. The Whole Person Health Index. This is an index that has been developed by NCCIH. This is the most recent meeting I attended. And WPHI is something we need to actually embrace and welcome. And a client-centered approach are slowly becoming evident in integrative approaches. So integrative medicine has the potential to emerge as the medicine of future, including integrative oncology, where the best options will be cherry-picked for the most optimal outcomes for the client for all diseases, including cancer. Thank you.
Thank you so much, ma'am, for an enlightening session. Now it's a time for Q&A, but as we are running short of the time, if you have any queries, you can directly ask to the presenters. So now we are moving to the conclusion by our co-chair.
Good afternoon, all of you. Respected Chair, Dr. Meeta Madam, and Secretary Sir, and all other eminent people assembled here in audience, and the land speakers. today we have scintillating, mind scintillating informations shared by the three speakers. So the first speaker, Professor Katiji, it was so informative, vivid, and you require more time to show all your works to be understood for the audience and even to the chair actually. So within 20 minutes and little extra time also you consumed, but the time was not sufficient. And when you are talking about green nanotechnology and the bridge to cellular delivery, once I touch three speakers and their important insights they have shared, then I'll give some novel ideas how we are going to approach to treat malignancies from Ayurveda. So, as you are telling, ancient literatures, they require revalidation. And revalidation can be done on a modified resources like not only through RCTs, we need to develop a modified RCTs as shared by other two speakers. When Kadamba was used to treat malignancies at different levels, and you have presented data on IL-12 and IL-6 and IL-10, which is very, very important, and we require more informations on that. If you can show, if we can follow your websites and publications, I think we get more details on that. That was so important to understand how the apoptosis and other epigenetics are involved and how they are being modified by these medications. Thank you for such a wonderful information shared, Professor Katiji. Second, Janatul Firdausi, Madam. So your presentation, your work was really, really commanding. So you specified about regulation, resilience, and repair using the epigenetics concept again, because we have more potential to influence in epigenetics area. It has been believed, and it has been worked, and it has been presented, published in various platforms. So metastasis, this is one of the important aspect. Dr. Firdausi Madam shared her insights on recurrent medulloblastoma, where after treating the person, he survived for more than 27 years by addition of quality of life. That was really commendable, and it is noted, Madam. And system biology frameworks like reductionism and host control, Rogi, Roga, which is vividly covered by the third speaker. So this is also a wonderful area and need integration as such. And use of Nasya and Anjana, it's really a thought-provoking idea you have shared using both of them into malignancy care. Because Nasya is a Ashukari Chikitsa, Anjana is a Ashu Falakari Chikitsa. So if you can club these things, it is definitely going to modulate the modality of the overall treatment protocols. And the importance of chronobiology, that is also important. Posology and Aushadha Sevana Kalas, they come into influence the overall care what we are providing to the patient. And lastly, she has very rightly pointed out the fear conquer. By inducing dhairya, it can be by any way. Madam has added yoga protocols for that. Fear should be conquered. We all know that COVID victims are more because of mortality rate has increased because of the fear factor only there. So that is one important aspect she has mentioned. And coming to the third speaker, Dr. Pratibha Shawji, Ayurveda and Integrative Oncology. She has done the Rogi and Roga. These two aspects are important here. And we have much novel concepts embedded into Ayurveda, which are not very popularly used for researches and treating the cases. So like Ardhraka, ginger, into different forms, especially in postnasal post-chemo nauseas, how this is going to help with the dosage additions and dosage divisions, she has very nicely mentioned. And considering into microenvironment of the host, this is really, really important while we are looking into holistic approach for any sort of integration. So Ayurveda not only speaking about the Chikitsa Sutras, it has embedded some jewel-like managements into its incorporations. Like if you think about Vardhamana Prayogas, where the disease Rogi Bala in malignancies will be increasing day by day because of various factors, cell division, if you consider the severity of the disease, you consider like that. So if you adapt Vardhamana Prayogas into a clinical level, and this is not impossible, we are practicing with this, and we are supporting a lot of cases in government Ayurveda hospital attached to the BR Care Government Ayurveda College at Hyderabad. We are using Vardhamana Prayogas in various contexts to support the patient to add to addition a lot of benefits from the system of Ayurveda. And second thing, Rasayanas. So this is also major Rasayanas. Because you know, Dirgamayam Smritirmeda Arogyam Taranam Vayaha Prabhavarna Swaraudaryam Dehendriya Balamparam. So we ignore the Smruti Nasha there. So Dirgamayu, Dirga Smruti. So cell forgets how it has to divide after certain age. Let it be 40s, 50s or 60s or any time. So this is what we call a precursor. So if you can use major Rasayanas appropriately into cancer care with a proper amalgamation and blends, this is also going to help, and we are adapting this particular model also. And then you know about Panchavida Kashaya Kalpanas. Among them, Himakalpas, like Punanava Himakalpa, Amalaki Himakalpa, where we can influence the neoangiogenesis through these modalities. We are also using this, and these are few hidden areas from Ayurveda where it requires more focus and more thrust to be given for such sort of managements to promote holistic, integrative approaches to handle malignancies in a better way. With this few words, I take permission to stop my event. I congratulate all the three speakers and my chair for all the coordination and this thing. I thank organizers for providing me this opportunity. Thank you so much.
Thank you so much, sir. Now we are moving to the last part of the session. We want to honor the presenters and the chairs. Now I'd like to invite Dr. Mita Kotecha ma'am to receive our token of gratitude and appreciation. Babu, our co-chair. Now I invite Dr. Mita ma'am to present the mementos to our presenters. Represent Dr. Kateshwi Katti. Dr. Jannatul Firdaus Changamballi. Now I invite our co-chair, Dr. Shrikant Babu, to felicitate Dr. Pradipha Shah.